I want to ask you something no one asked me during nursing school, and I suspect no one has asked most of the nurses watching this either. How many clinical judgment calls do you make in a single shift? And I don't mean the dramatic ones. The rapid response you called, the potassium you caught before it showed on the monitor. I mean all of them. The ones in the hallway, the ones in the 30 seconds between a daughter voicing a worry and you deciding what to do. The ones that happen so fast, you don't even count them as decisions. They start at handoff. Nurses begin forming judgments about deterioration risk during change of shift report, and they don't stop until you give report at the end of the day. If you actually counted them, it would be one every 12 seconds. And here's why that matters so much. The NCSBN's own analysis found that clinical judgment is directly linked to more than 46% of nursing practice errors. Nearly half of what goes wrong traces back to a judgment failure, a cue not noticed, a pattern not named, an action not taken in time. Now sit with the uncomfortable part of that. Nearly half of nursing errors come down to clinical judgment. And yet, when was the last time anyone explicitly taught you how to make those judgments? We assess it, we grade it, we rarely teach it as its own skill. There's also this persistent myth that clinical judgment belongs in the ICU or the ED. Anyone who's working a busy Med-Surg floor knows it's actually backwards. Higher patient loads, sicker patients, multiple comorbidities, and no continuous monitoring. Med-Surg is where clinical judgment gets its daily workout without the infrastructure that buys ICU nurses a few extra seconds. A 2023 study of 20 Med-Surg nurses found that what we call intuition, knowing something is wrong before the numbers confirm it, is actually clinical judgment running at full speed. They felt the shift in a patient's affect. They noticed the family was quieter than usual. They caught that a patient who'd asked for pain meds every 4 hours hadn't asked once in 8. That is not a gift. It's a skill that can be taught. So, how do you teach it? Not with more content to memorize, with an explicit framework. Let me give you the core of it. Before your student ever walks into a patient's room, they answer 3 questions. What is this patient's biggest risk right now? What is the earliest sign that risk is becoming real? And what will I do immediately if I see it? Those aren't documentation prompts. They're a cognitive habit. They flip a nurse from reactive care to anticipatory surveillance before the door even opens. Then, inside the room, every finding runs through 4 questions. Is this expected or unexpected for this patient? Benign or pathological? Chronic or acute? Stable or unstable? That's not a checklist. That's the structure that turns an observation into an interpretation, and an interpretation into a decision. Act, watch, or escalate. And then comes the piece that changes everything. Teach nurses to read across systems, not one finding at a time. A single abnormal finding is a data point. 2 findings moving together are a pattern, but 3 or more systems shifting at once, all pointing to the same cause, that's a signature. And every signature has one physiologic driver behind it. Here's the difference that makes. The nurse who sees 4 separate findings generates 4 separate explanations. The nurse who sees one signature names the physiologic cause and acts. That is the line between documenting a trend and acting on one, and it is completely teachable. So let me make this personal, depending on who you are. If you're a nurse educator, your students will walk into a Med-Surg floor and make clinical judgment calls within their first hour. The question was never whether they'll be asked to judge, it's whether you've given them a framework to do it. If you're a nurse manager or education leader, the nurses on your floors are already doing this work every shift. Investing in their clinical judgment isn't enrichment, it's the core of patient safety. And if you're a bedside nurse, the judgment calls you make every shift matter more than any single item on the care plan. You are the surveillance system. You are the early warning system. And you deserve to have that work named and supported. If you want a framework for teaching exactly this, come find me at LifeBeat Solutions. Thanks for watching.